Lady from Florida, Ms. Brown-Waite.
Gentleman from Florida is recognized for 4 minutes.
Thank you very much. Thank you, Mr. Speaker. I know Joe Wilson. I've worked with him in the halls of this Congress in committees, and I've traveled with him to Iraq. A retired Army colonel, all 4 of his sons followed Joe into the military service. In the 7 years that I have known him, I have never known Joe Wilson to say an unkind word about anyone. Joe is a good and honest man. He's the kind of person who, if he disagrees with you, does it without being disagreeable. Just as it was wrong for my Democrat colleagues to boo former President Bush in this chamber, it was wrong for Joe Wilson to speak out of turn. The difference is that Joe Wilson apologized, and the President very graciously accepted his apology. Every member in this chamber has uttered words they wish they could have said differently. I know Joe made this comment out of frustration because there seems to be a large gap between health care rhetoric and reality. What the President said did not match up with the bill that came before the House. This is the same bill that was discussed last month in many town hall meetings across our country. His comments provided Americans with an opportunity to discuss the differences between the bill they've seen and the ideas that the President mentioned on Wednesday's speech. On the issue of illegal immigrants in health care reform, in 3 committees here in this very House, Republicans offered up amendments to clarify, to ensure that illegal aliens would not be included in the health care reform bill. In all 3 committees, those amendments were resoundingly defeated by my Democrat colleagues. All Americans heard the President say, "If you like your plan, you can keep it." But those words directly conflict with the CBO's findings that cuts to Medicare Advantage plans in H.R. 3200 would result in millions of seniors losing their current plan. That's not keeping the plan that they like. Further still, we heard the President say that his plan would not add 1 dime to our deficits. Again, that's contrary to CBO's findings that say that H.R. 3200 would increase deficits by $239 billion over 10 years. Mr. Speaker, there's a lot of frustration in our districts and throughout America about H.R. 3200. We need to stop wasting time and get down to the business of drafting a bipartisan health care bill that addresses the needs of all Americans. Think of how many Americans lost their jobs and lost their health care coverage during this 1 hour of debate that we're having today. We need to get down to the serious business that our constituents sent us here for. That's the very least that we can do. That's our job. I yield back the balance of our time.